So the industry is booming right now. We are in February 2025, and I have seen more openings and more hiring than I have seen in the last 6 months. If you align yourself correctly, there's more opportunities out there for you to get seen and possibly get that next offer that you're looking for. But it's not going to come just falling in your lap. You're going to have to do some things to make yourself successful. And my number one is, how is your resume? Is your resume formatted for clinical research? Is it with a professional summary at the top? Does it highlight your skills? Does it highlight your therapeutic area experience, your clinical research system experience? Does it talk about the roles that you've done and what your responsibilities are? All of these things are important to have in your resume and have it in a nice, easy to read format. So, are you positioned with your resume to be able to stand out in a crowd? Now, if you haven't received callbacks, if your resume is not clear, if it just goes from your name and straight into education, that's not the best format. You need to start with a professional overview. Who are you? On my resume, I say I'm a clinical research professional with over 20 years experience across the following roles, and I list my roles. I also talk about the phases of research I've done, phase 1 through 4, oncology, rare disease, women's health, gastroenterology. I have that outlined. I also talk about some of the things that I've done, process improvement, vendor oversight, CRA management, highlighting the things that I've done from study startup, from study closeout. These are important characteristics and traits and everything to put at the beginning of your resume. If you don't have that, you're missing the opportunity for a potential employer to see your value, to see what you can bring to the table. If you just go right into education, that's good. That's almost like a given. We're thinking everyone in our industry has, some sort of education. You're missing that opportunity to really say, bam, this is who I am and this is what I can bring to the table. First things first, make sure your resume is properly formatted. Once it's properly formatted, that's your first good direction to getting hired. If you need more help with your resume, check out our clinical research job guide. It has a resume template structured for clinical research roles. It has resume pro tips. It has an example of a professional summary. These are things that you need. You can't try to navigate the clinical research industry with a non-clinical research industry resume. It's just not possible. You may get lucky, but potential employers, they're expecting to see a certain format. Make it easy for them to go through your resume by giving them the format that they're looking for. Otherwise, you run the risk that you just move to the no pile because they can't figure out what's going on your resume and they're expecting to see this and they don't. And they say, I don't have time. I'm going on to the next one. That is some of my advice. The market is hot. Let's take advantage. Let's make sure that you're able to capitalize on the hot market right now. All right. See you soon.